from being England's Chief Inspector of Hospitals. We're joined by Professor John Appleby, who's Director of Research and Chief Economist at the Nuffield Trust, a charity that seeks to improve healthcare through independent evidence and analysis, and by Niall Dickson, the Chief Executive of the NHS Confederation, which speaks on behalf of the health and care system. Good morning to you both.
Good morning.
Niall Dickson, when Mike Richards says that more money is only part of the answer to the NHS's problems, is he right?
Yes, he's absolutely right. Money is necessary, it's a prerequisite, but it's not sufficient. Simply pouring more money into the NHS is not the answer. It does require additional funding, both in the short term, and there needs to be a proper analysis and a national conversation about what we need in the longer term, because the challenges ahead are very considerable. But even in the short term, it needs a fundamental transformation. We have a system that was essentially designed for the acute sector, the hospital sector, to deal with more and more operations. We need to move it so that instead of people just turning up at the hospital sector when they're really ill, they need to be prevented from getting there by developing services, different sorts of services in the community.
So would you say, or could you say, it is more an organisational challenge than a financial challenge?
Well, I wouldn't compare them. I think they're both absolutely required. You can't do this without additional money, and you have to recognise the additional pressures that have been put on the system. I think the system has been more resilient than many of us predicted over the last 7 or 8 years. It's done much better than people thought it would do with historically low levels of additional funding, and that is the challenge going forward. But it also needs to transform.
Professor Appleby, what do you think?
Yes, it's probably a false trade-off. I think most people who look at the NHS would agree that, as Neil's saying, it's done really well from between 2010 and sort of 2015-16. It's managed to keep to target with waiting times and so on, but things have slid since. I mean, this mantra about no more money without reform. Quite often people don't specify what they mean by reform or transformation. What is it we're really talking about? And I have to say, in my research, one of the things that's really struck me is that the big things that have really changed healthcare, not just in the NHS, are not via a circular from the Department of Health saying we're going to reorganise the deck chairs down there for you lot. It's come more bottom-up from clinical development, so the development of more local anaesthetics, for example, has allowed the NHS to do more day cases, and you stay less time in hospital, less invasive surgery and so on. It's that sort of thing that the health service needs to be encouraged to do. And as Neil says, that sort of thing takes time and it takes investment.
And isn't a significant part of the reason it is done better in this period of austerity than many people imagined is because of the commitment of its staff, and because people have done more, and we're now starting to see people leave the system because it's such a hard job and it's becoming harder by the day.
I think that's certainly true. So I think people have worked harder. They're actually working harder for less real pay. I think we have to remember that there's been a pay cap, and before that a pay freeze. 7 years now, so NHS staff have contributed literally billions of pounds into the NHS to allow more patients to be treated and so on. And I think over the long term, yes, reform and transformation and clinical change, that will all happen. What the NHS is in is a short-term trough at the moment, and it's very difficult to see how it gets out of that.
Niall Dickson, on the staffing point, and Professor Richards said that he supports the lifting of the pay cap, but you could lift the pay cap and give people who work in the NHS more money, and they could still decide that it's too difficult a job to do in the present circumstances.
Pay's only one element of it. I think there is a degree of frustration. Inevitably, if you hold people's pay back over a long period of time, there eventually comes a time when they get very frustrated about that. But it's clearly about how well staff are valued. And actually, the latest NHS staff survey is quite positive. Amazingly, people working under enormous pressure, but actually feeling more valued by their organisations than they did a few years ago. So I think it remains a huge challenge about how you retain staff, how you value them, how you make sure, and that is the key to transformation actually, people feeling that they're part of an organisation that's going somewhere that values them and that they will change their practice. I think there is a danger of too much central control, as John says. Sometimes central control works. Waiting times and targets in the 2000s came down, largely as a result of directions from the centre. But there's also a problem at the moment where people feel that regulators from the centre are putting too much much pressure on organisations, and it has a counterproductive effect.
Professor Appleby, you said reform was a very easy word to use without making it clear what you meant. Integration of health and social care, another word very easy to use.
Another word. I mean, in all my over 30 years working in healthcare, we've talked about integration, we've talked about, working together closely with social care and so on. And it has happened up to a point. We do have an example. Northern Ireland notionally has an integrated health and social care system, although if you talk to people in social care, they don't necessarily feel that it's quite like that.
But it operates better than it does elsewhere in the UK? Does it operate better, the two bits of the system?
Not really. I mean, at the moment in the NHS, you have difficulty getting into hospital, and you have difficulty getting out the other end as well. So with the delays, and that's an issue to do with the coordination of social care and healthcare.
John Appleby, Niall Dickson, thank you both.
9 minutes to 9. To children who move to Europe from Africa, come here to flee war and persecution, or are they economic migrants simply seeking a better life? UNICEF have been trying to answer that question by interviewing many of the young people who come to Europe, in particular Italy and Greece, unaccompanied, and the answers are intriguing. Justin Forsyth is UNICEF's Deputy Executive Director and joins us in the studio. Good morning to you.
Good morning.
What have you found? What have your staff found as they've been talking to these children?
Well, we work with many of the children once they get to Italy, but we also work with them in Libya, but also in the countries they come from, whether it's Nigeria or other countries in West Africa or Eritrea. And we know from all of that and this survey that we've done that many of the children that are coming are fleeing conflict or poverty, but actually other factors too. For example, forced and early marriage. Either they don't want to get married young. There might also be violence in the home. So there are many factors. And the interesting thing and the frightening thing about the children coming across the central Mediterranean from Libya is that 9 out of 10 of them are travelling alone. And they're often leaving home enticed by traffickers who they don't even know they're traffickers. They might be a friend or a relative who offer them something to get out of their bad situation, and then they begin a journey. And when they get into Libya, then they're treated like slaves, or they're locked in underground prisons. The girls are often raped.
So when we talk of them travelling alone, have they also often taken the decision alone, or have their parents taken a decision in advance? No, we want you to head to Europe. That's where you should get to.
Well, it is different country by country. In Eritrea, many of the children are fleeing forced conscription. But in West Africa, they're often deciding to go by themselves to flee conflict or poverty or this early marriage situation that they might face without their parents' knowledge. And often they're enticed by these traffickers to escape the situation. Many of them aren't intending to come to Europe, but the traffickers then take them on this journey, and particularly the girls. Many of the girls are sold into prostitution in Italy. I met a girl that had told me a terrible journey of coming through Libya. She was locked in an underground prison for 8 months and raped every day, and then she was sold into prostitution in a railway station in Italy.
What's the conclusion you draw from this analysis? Because often the debate is whether there are pull factors. Is it something that we are doing here, the access to benefits, the access to jobs or housing, that is persuading people to come? Or are you saying basically conditions are so dreadful at home, they'll make the journey come what may?
Well, the reason it's important is because there's pull and push, but the push factors are much bigger than we think, whether it's conflict or poverty or early marriage. And that means we can do something about it. That means by investing in those countries, solving some of those problems, addressing poverty, conflict, we can actually prevent so many unaccompanied